In my last video, we talked about painful sex, which is also called dyspareunia. Sadly, menopause is a time when many women experience symptoms like vaginal dryness and shrinking and thinning of the vaginal tissues that can actually lead to tearing and bleeding. It's not supposed to be that way, but I've heard from hundreds of women who are really struggling because menopause is negatively affecting their relationships. They just don't know what to do. I'm Steve Goldring, the hormone pharmacist from simplehormones.com. I've earned multiple certifications about hormone replacement therapy. Hundreds of hormone doctors all over the US, Canada, and even the UK trust me to teach their patients about hormones that aren't too high and they're not too low, but they're just right. I help women in menopause answer one simple question. Is HRT right for my menopause symptoms or not? I've created a clear, concise digital course that helps you make your HRT decision in about 2 hours, more or less. For information about that course, visit my website at simplehormones.com/decision. I posted a video about an estradiol vaginal insert called Imvexxy. That product is specifically designed to help with dyspareunia, painful sex, along with other symptoms of the genitourinary syndrome of menopause, or GSM. Imvexxy replaces the estradiol that's missing from the vaginal tissues. It addresses that root problem in menopause that's causing those vaginal symptoms. You can use vaginal lubricants and moisturizers, but they don't really touch that root problem, which is the loss of your hormones. There's another really interesting way to address the loss of estradiol in the vaginal area. That is to use what's called a pro-hormone. A pro-hormone is converted within the tissues to estradiol. Well, I've been a big fan of a research scientist named Dr. Fernand Lebris from University Laval in Canada. Dr. Lebris was the world's foremost expert on DHEA, or dehydroepiandrosterone. It also goes by the name prasterone in some countries. Before he died in 2019, Dr. Lebris discovered that DHEA acts as a pro-hormone. It gets into your tissues and then is transformed or converted from DHEA into estradiol or testosterone as you need it. That's exactly what happens in the vaginal area when you insert a vaginal insert or suppository that's called Intrarosa, the only vaginal non-estrogen treatment for moderate to severe painful sex due to menopause. The clinical trials for Intrarosa showed it was very effective at changing the vaginal tissue of postmenopausal women. It helped them feel better about dyspareunia and painful sex. Surprisingly, DHEA even increased their sex drive, possibly because of the increased testosterone levels in the genital tissues. DHEA vaginal suppositories are very well tolerated. There were really no serious side effects. The only contraindication for DHEA is in women who've had a lot of vaginal bleeding that's not explained. DHEA doesn't increase your blood estradiol or testosterone levels very significantly. It doesn't have all that much of an impact on the body as a whole and mostly works right in the vaginal area. One thing I'd like to point out is that DHEA is available over the counter as an oral capsule, a nutritional supplement, at least in the US, not in Canada. But oral capsules of DHEA don't have any impact on all the dyspareunia, painful sex, or any of those vaginal menopause symptoms. The retail price for Intrarosa is around $270 for 28 inserts, maybe a month's supply, or possibly a little more. I'm not sure if Intrarosa is covered on insurance, but I wouldn't be the least bit surprised if it wasn't. If you're interested in getting some relief for dyspareunia and other vaginal menopause symptoms, the first person to check with might be your primary care provider. You could even ask your doctor if they've heard of Intrarosa. Don't be surprised if they haven't and they don't know anything about DHEA used for vaginal menopause symptoms. I've created a simple, downloadable HRT questions framework that helps you ask your doctor about their approach to hormone replacement therapy, or HRT. Visit my website at simplehormones.com/HRT-questions to get a copy of this free resource and start that conversation. It's designed to open up a non-confrontational conversation. If you can't get help from your doctor, I know a lot of hormone specialists who might be able to help you. Click the link at the end of this video that says Find a Provider, and I'll see if I can't refer you to one in your area. If you found this video helpful at all, click the like and subscribe buttons. You might also want to ding that little bell to get notified anytime I post a new video. Thanks so much for watching, and I look forward to talking to you again next time.